Welcome to the Obesity Coalition, where our vision is that all health professionals are comfortable and well trained in engaging in person centered obesity prevention and management in a way that is respectful and avoids stigma. Our mission is to lead an international coalition of medical educators, clinicians, researchers, policymakers, and persons with lived experience to establish strong partnerships and knowledge dissemination channels for expansion and implementation of effective tools and resources, including advocating for changes in educational accreditation and licensure standards by 2030. Let's introduce some of our members and share some of our current initiatives and success stories.
My name is Denise Campbell-Scher. I'm excited to welcome you to the Coalition to Improve Care for People Living with Obesity through education. And so we started the coalition 3 years ago because we really recognized that there was a huge gap in terms of training across the board for health professionals, including physicians. I'm a family physician and researcher here at the University of Alberta and beautiful Edmonton. This is a bit of false advertising because right now it's winter, and when I look out there, it's all ice and snow. So this is what it is in the nicer time of year. So a group of us have been working on obesity, and a number of things have happened recently that are really exciting. We've completed the new Canadian obesity guidelines. I was really thrilled to be part of the executive for that effort. And our team at the University of Alberta does a lot of work around the 5A's team program, which you can see all of our work on our webpage at Obesity Canada if you look at the 5A's team program, or FAST. And you'll see all of our videos and resources and tools and things there, as well as links to the coalition and all the great work that the partners are doing. So I think this is going to take a village to change the prevailing understanding and care for people living with obesity. So hopefully, if you're interested to contribute, you'll come out and participate with our coalition.
Hi, my name is Melanie Hetherington, and I'm an education specialist and research coordinator working with Dr. Denise Campbell-Scher at the University of Alberta in Edmonton, Alberta, Canada. You've already heard from her about why we formed the Obesity Coalition and a little bit about the FAST program of which I'm a part. One of the projects that I've been quite involved in over the past few years is in the development of a course for healthcare professionals to train them on how to have collaborative, person-centered conversations with their patients around obesity management. Our course was initially integrated into the curriculum for family medicine residents, but has since been adapted to the virtual environment and is now available to all practicing healthcare professionals. The content aligns closely with the Canadian Clinical Practice Guidelines for Adult Obesity, covering topics such as pathophysiology, drivers, root causes, as well as weight bias and stigma, assessment of both adult and pediatric populations, behavioral and lifestyle management, pharmacotherapy, and bariatric surgery. We also teach about an approach and toolkit that we developed through the FAST program, which is used to guide clinicians through the conversation. Thanks to members of our coalition, our toolkit has now been translated into 5 different languages, including French, German, Spanish, and Chinese, with a Portuguese translation currently in progress. The coalition has been instrumental for our initiatives as it allows us to connect to other researchers, educators, healthcare providers, and people with lived experience. It's an opportunity to share about projects we're working on and explore gaps in obesity education in different parts of the world. If you would like more information on either the coalition or the FAST program, I would encourage you to check out our webpage, where you will also find links to tools and resources. Thank you so much.
Hi there. My name is Michael Vallis. I'm a health psychologist from Dalhousie University in Halifax. And my interest in the coalition is really in promoting the management of obesity, looking at it through a psychological lens. I'm the primary author on the Psychological Behavioral Guidelines chapter, in which we really recognize that all interventions are basically based in behavior. So there's a requirement really for us to understand and incorporate psychological behavioral interventions, and this is the work that I do. And so my interest really is in competency, and if we look at the landscape now, we could see the following journey, that we've got a number of interventions based on Pavlovian associative learning, Skinnerian reward learning, what we call first, second, and now third generation cognitive behavior therapy, all of this being integrated together into a theoretical framework that provides a good structure for addressing the psychological aspects. But this is a skill gap, really, and my desire is to fill this in by really promoting the role of obesity behaviorist.
Hello, my name is Sonia Wicklum. I am a clinical assistant professor at University of Calgary in Alberta, Canada, and a happy member of the Obesity Coalition. I'm going to present 3 projects. One is the primary care pathway for the prevention and management of obesity. It's been a 3-year quality improvement study trying to address the lack of organized care for patients with obesity. We're leveraging the relationships family doctors have with patients and the strength of our allied health team members. It's up and running in 10 large clinics with 81 physicians. Our results have shown excellent improvement in patient and provider experience and an increase in patient activation. We are planning expansion and further research on this pathway. The second one is an educational program for family medicine residents in the prevention and management of obesity in primary care. This course is experiential, involving interactive lectures, personal assignments, reflective assignments after providing care, an optional bariatric suit experience, and working in small groups with standardized patients. Lastly, we have the Wolf Trail program, which is a holistic, inclusive, physical activity-based program for Indigenous women. We have completed 14 programs over 4 years in 3 different locations in Alberta, and it is extremely well received. We have an extensive team. We're presently completing a CHR development grant, bringing together multiple new communities that are interested in running programs, and we plan on a multi-year step wedge control trial coming up in the future. Thank you very much.
Hi, I'm Dr. Dana Lee Bagley. I'm a registered psychologist from Halifax, Nova Scotia. For most of my career, I've worked in surgical, medical, and cancer care units at the hospital here in Halifax. I also do research at Dalhousie University in the Faculty of Medicine and at St. Mary's University in the Department of Industrial and Organizational Psychology. Currently, I run a virtual health psychology clinic where we do clinical interventions for people with chronic disease, training of healthcare providers in chronic disease management, and research in behavior change. The reason I joined the Obesity Coalition is that I love that it brings people together. It's fantastic that we don't have to reinvent the wheel, and in fact, to feel supported in doing something that can feel daunting and overwhelming at times, because there's a lot of things that need changing and fixing in regards to obesity management in the healthcare system and in the general society. And so it's always really helpful to be in a group of other people with the same values, working towards the same things, working together. And I believe that's how eventually we'll make change on this really important topic.
Dr. Abraham is an assistant professor at the University of Alberta and currently serves as the undergraduate pre-clerkship director in the Department of Family Medicine. His work involves clinical teaching at one of the academic residency training sites for family medicine, along with undergraduate teaching in a variety of capacities. He is currently the co-director of the communications course at the University of Alberta Medical School and is working on a longitudinal obesity curriculum throughout all 4 years of training.
Hi, my name is Melanie J., and I'm a general internist and an associate professor at the New York University Grossman School of Medicine in New York City. I also see patients at the New York Harbor Veterans Affairs, and I live in Brooklyn. Most of my professional life is spent doing research. I conduct health services research and behavioral intervention studies related to obesity in primary care settings. I also direct the NYU Langone comprehensive program on obesity that seeks to promote collaborative research at the interface between basic science, clinical medicine, and population health, as well as improve clinical care and education around obesity. Through this program, we started a clinical obesity fellowship 3 years ago. I joined the coalition to collaborate with like-minded, interdisciplinary healthcare professionals dedicated to improving obesity care and reducing obesity-related stigma, especially in primary care settings.
Dr. Tasneem Sejwani practices family medicine and obesity medicine in Edmonton, Alberta. She completed her family medicine training program at the University of Alberta in 2008 and is a diplomat of the American Board of Obesity Medicine. She is committed to make obesity management accessible and to challenge obesity bias and stigma through her practice and advocacy. She is currently the medical director of the Edmonton Weight Management Center and Family Practice.
Hi, my name is Marcela Rodriguez Flores. I'm an internist working as consultant at an obesity and eating disorders clinic in Mexico City, which has a population of over 20 million people. It's a beautiful city full of contrast where technological advance coexists with a traditional sociocultural way of life. It's also a city with a geographical location that gives a nice mild weather, close to beautiful mountains, including an active volcano which now and then spews ash. I work at the National Institute of Health Sciences and Nutrition, an academic hospital that provides tertiary care with the highest rate of original health research in the country. My research project focuses on the long-term health and nutritional outcomes of bariatric surgery within our context, the implementation of primary care obesity treatment, stressing the inertia for science-based approaches and the usefulness of frameworks such as EOS and the 5As. The mechanisms mediating cardiovascular disease of obesity and obesity treatments, and the neurobiology behind obesity, eating disorders, and addiction. I joined the coalition recognizing the importance of a broad view of real-world advances and sharing of ideas and barriers with colleagues of diverse backgrounds. We know that Mexico and countries in the Latin American region share several cultural, socioeconomic factors that promote a high obesity prevalence, but there's a long way to go into generating more effective resources for people living with obesity that consider local factors as well as biological ones. So I'm happy to collaborate with diverse initiatives. Gracias. Thank you.
Hi everyone, I am Erika Reis. I am a Brazilian researcher in Brazil. I am a nutritionist and a professor and research on the topic of obesity care in the public health system, mainly in primary health care. This is my University of Ouro Preto in Brazil. This is my research topics about the obesity in adults. This is about clinical guidelines, the assessment multidisciplinary treatment, the activities via telemedicine and mobile health, and the quality of life the people with obesity. This is my research in progress. The development of a mobile app for adults with obesity, the adaptation of the 5S tool and the EOSS to Portuguese, and the invisibility of people with obesity in the primary health care. This is my contact. Obrigada, and thank you in English. It's very good to be part of the coalition and to learn about the care experience for people with obesity around the world. Yes, thank you.
Dr. Marcia Casera is a family physician with a special interest in obesity medicine and healthcare quality. Dr. Casera is a clinical lecturer for the Cummings School of Medicine, University of Calgary, and she has been teaching medical students and residents in family medicine since 2015. She is a diplomat of the American Board of Obesity Medicine. Her passions aligned with the vision of the Obesity Coalition, with promoting learners to engage in person-centered obesity prevention and management. She is also interested in quality improvement for patients and their families with lived experience with obesity and reducing stigma and bias in how healthcare is delivered.
Hello, my name is Amy McPherson. I'm a senior scientist in the Bloorview Research Institute, housed within the Holland Bloorview Kids Rehabilitation Hospital, and also an associate professor at the University of Toronto. My research focuses on health promotion for kids with disabilities, and weight management has been one part of that. I'm also interested in how people have so-called difficult conversations, and sometimes weight management can be one of them. And healthcare providers feel very underconfident on how to approach the conversations with children and their families. So after about 10 years of research, including reviews and talking to children, their parents and healthcare providers, my team created a knowledge translation casebook, which aims to bridge the gap between evidence and practice which really translates the best practices and research into pragmatic, helpful snippets that healthcare providers can kind of then embed into their practice. Being part of the coalition has been great for me because although I'm only one of very few child researchers, it's really given me a much broader context around medical education for weight management more broadly.
Hi, my name is Ward Al-Najim. I'm a clinical nutritionist and a research fellow working with Professor Carl LaRue in University College Dublin in Ireland. My research work focuses on eating behavior and different obesity interventions. But away from my research, I have a special interest in developing tools and materials to raise awareness on obesity prevention and also, very importantly, obesity management amongst healthcare professionals. So I am currently actually working on such a program here in Ireland, but also a little bit far from here in my hometown, Iraq. Being part of the Obesity Coalition and a member of the Obesity Coalition has supported me tremendously in this type of work. I was able to connect with like-minded people, to have discussions, and also, very importantly, I was able to have access to some of the resources that instead of me starting all over from scratch, I was just able to build on the work that has already been done in different parts of the world. I'm grateful for this opportunity and I look forward to many more future collaborations.
Hello everyone, my name is PM. I'm an internist and a clinical nutrition specialist working in obesity medicine from the beautiful city of Bangkok, Thailand. I hope that you can all visit us sometime after the pandemic. I work here at Sirat Hospital, an academic medical center where we train residents and medical students. The reason that I joined the coalition was that I found it really hard to teach trainees about obesity, to enable them to really empathize with our patients and understand how hard it is to lose weight. So that's why I'm here. Here is the list of my ongoing research projects. The first project on weight bias was what led me to the coalition in the first place. And then the others are what my group and I are trying to get started at our center. And really nice to meet you. Thank you for your time. I hope that we can meet in person again soon. Thanks. Bye.
Hi, my name's Rayleigh. I have been worked as an endocrinologist and dietitian for more than 10 years in China. Now I'm pursuing my PhD studies at Lancaster University in the UK. I'm happy to share some of the exciting work my team and I have been doing with the help of a coalition. In 2019, we opened our city's first weight management clinic, and we have helped more than 1,200 patients. What's more, we have trained more than 2,000 nurses in Guangdong province to equip them with necessary knowledge and skills in obesity management. The Obesity Coalition has provided a platform to assess and share great resources and meets outstanding professionals in the obesity research field around the world. As part of my PhD research, I have focused on identifying effective models of care for obesity on a lifelong basis. With the help of the coalition, we are culturally adapting the 5As tool in China. We started a pilot program to implant the 5As tool as a patient-centered framework for people with cardiovascular disease and obesity. Our team has enrolled 50 patients, and the outcome has been very inspiring. If you are interested in my research or would like to communicate with me, please do not hesitate to contact me. Thank you so much for your time.
Hello, everyone. My name is Tanya Nagpal, and I am an assistant professor at the University of Alberta with the Faculty of Kinesiology, Sport, and Recreation. My research aims to understand health-related stigma with a focus on obesity and weight stigma from lived experience and implications on healthcare delivery and behaviors, specifically around pregnancy, including before and after pregnancy. My goal through research is to inform and develop person-oriented tools and interventions focused on stigma reduction to improve quality of healthcare and access and adherence to health resources like physical activity in preconception, pregnancy, and postpartum. Here are a few projects I've recently been involved with. First, in collaboration with Obesity Canada, we modified the adult weight bias internalization scale to be specific to pregnancy, and we surveyed a large sample of Canadian pregnant individuals to measure internalization of weight bias and relationships with gestational weight gain. We've recently also done a few qualitative projects learning from pregnant individuals about their experiences navigating prenatal care. Ongoing studies right now with results coming very soon include experiences of women of color who identified as having larger bodies and applying an intersectional lens to understand weight stigma. In another, we are exploring the intersect between potential gestational diabetes and obesity stigma and how this may impact quality of care and health behaviors. Finally, we have been working on a project to understand experiences of weight stigma in pregnancy and postpartum and implications on personal relationships. Ultimately, learning from experience can guide future directions, including designing tools and resources for healthcare providers, allied health professionals, and more publicly. Developing and implementing healthy interventions in pregnancy is another important goal of my research, such as accessible physical activity programs. Intervening in pregnancy with healthy interventions and overall improving quality of care will have a positive effect on the pregnant person, but also the next generation, our newborns. I have been actively involved with Obesity Canada as a volunteer for a number of years, most recently as a member of their Education Action Committee, and I am very happy to be a part of the Obesity Coalition. I joined the coalition for the opportunity to learn from their diverse collaborative network of persons with lived experience, educators, clinicians, researchers, and policymakers. I look forward to connecting with you, learning from you, and hopefully positively contributing together to the mission and vision of the coalition. Thank you.
Hi, I'm Louisa Ells. I'm a Professor of Obesity and Co-Director of our Obesity Institute here at Leeds Beckett University in the UK. I joined the Obesity Coalition as I'm absolutely passionate about person-centred obesity research and also training. Here at the Obesity Institute, we have one clear vision: to improve the lives of people living with or at risk of obesity. We undertake this through care, compassion, collaboration, inclusion and equality, and person-centred care is absolutely at the heart of everything we do.
If you are interested in joining the Obesity Coalition, or for more information, please contact Melanie Hetherington at her email address shown below, or find us at www.obesitycanada.ca/5as-team.